welcome to another exciting educational video. My name is Rich Savell, and today I have been volunteered to help be part of a video teaching the proper placement of a pelvic binder for a person with an unstable pelvis. Our educator today is Dr. Ron Simon. He's our Director of Trauma and Acute Care Surgery here at Maimonides. Dr. Simon.
Thank you. So a 38-year-old male comes into the emergency department after, while intoxicated, drives home on his motorcycle and crashes into a tree. He comes into the emergency department, he's hemodynamically unstable, and on physical exam clearly has a fractured pelvis. So in this scenario, you're going to want to put on a pelvic binder relatively rapidly. So one of the binders available is called the T-Pod, and I just want to go over the appropriate and proper placement of the binder. So in order to place the binder, you need to be able to roll the patient before you place the binder underneath. And so my assistants will come and safely log roll our patient so that they maintain spinal stabilization.
1, 2, 3.
So I'm unfolding the binder. I'm leaving a little extra on the side. I'm lining it up together with his trochanteric heads of his femurs. Okay, you can roll them back.
1, 2, 3.
Okay. Great. So once you are sure that the binder is in the middle of his greater trochanteric prominence, you then size the binder to fit your patient. It's obviously meant to fit many sized patients. You want approximately 6 inches between the two ends of your binder. Some people cut the binder. I usually just fold it. So once it's in the appropriate place, you take your binder and you line up the orange dots of the T-Pod at the edge of your binder, making sure it's secure. And then once that's secure, you then pull down on your T-Pod, bringing the orange dots together, and that reduces the pelvic volume and hopefully will reduce any pelvic bleeding that might be ongoing. And then once you wrap it around these edges, you can then secure it again with the Velcro. So just to review, once you've assessed the patient, decided that they needed a pelvic binder, and you have your binder underneath such that it's in the middle of the greater trochanters, you take your folded ends and then you take your binder and you place it such that the orange dots are right at the end of your edge of the binder, and then you pull your string tight so that the dots come together, and then you just secure the binder in place. At this point, the pelvic binder is placed. The pelvis is a little bit more secure, easier to roll the patient and to move the patient if he has to go to CT scan or for any further interventions. So that's how you would place a T-Pod pelvic binder in a patient with a pelvic fracture.